Welcome back. Stakeholders in the health sector are now calling on the Kenyan government to fast-track and fill the gap left as a result of the United States donor funds freeze. The Ministry of Health projects close to slightly over 58,000 new HIV infections by the year 2030. HIV support NGOs now say they have been forced to cut down on their staff, with some staring at a possible shutdown, which may affect the gains made. Helen Aura with more details.
According to the Ministry of Health, at least 41,547 PEPFAR-supported staff have been affected by the USAID stopgap working order. To bridge the gap, the Ministry of Health has suggested to maintain 11,059 frontline healthcare workers as identified by the county governments. The ministry says the fund freeze has set them back at least 5.85 billion Kenya shillings in HIV human resources. Civil society and donor-funded NGOs have voiced their concerns, highlighting the tumultuous challenges Kenya could soon be facing.
Our funding came from USAID and PEPFAR, and the USAID funding was to support orphans and vulnerable children in Kilifi and the environs. So as we speak, the stop order has affected us as WOFAC in that we have 34 staff who have been laid off from work, and these staff work directly with the communities to make sure that orphans are taken care of.
Now, the sputum sample transportation is not happening, and we know for you to know if somebody has TB, you have to test the sputum. So if samples are not taken to a place where they are supposed to be tested, that means you will not know who has TB and who doesn't have TB, which means that the infection continues to spread around the country. And we had made gains in terms of reducing the TB infection, but now with this stop work order in the funding freeze, there is a possibility that we will not know who has TB, and TB will continue spreading.
According to the Ministry of Health, the funding freeze will also affect laboratories' transportation, CD4 testing done through lab networking, availability of reagents, and early infant diagnostic. ARVs are currently available. The only challenge now is the lack of trained healthcare workers in the HIV sector to dispense them.
With the integration of services at the health facility, it will become very difficult for people to actually walk into the facility and get their medication because there's no confidentiality. And you don't want to go and queue there and they start asking you, Dorothy, you're the one picking ARVs, please come to this window. I mean, some of those things will stop people from going to pick their medication at the facility.
All parties are now calling for a speedy resolution to salvage the situation.
We may not feel the impact actually right now, but months to come, teenage pregnancies, new infections among young people, some of the TB infections might go high, malaria, what happens to many women and children who access this support. So there is need to put our efforts together now more than ever to not work in silos, but to really synergize our work and everything that we do to be able to come up with a way forward.
Helen Aura, NTV.